town hall. And I just want to tell you, Joe, in the last 2 weeks, you've made history in presidential politics in America. You're going to make it again come this St. Patrick's Day in the city of Chicago and the state of Illinois. And we're going to give you a chance to lead our nation. So when St. Patrick's Day comes around, I'm going to be casting my vote for President Joe Biden. And this young lady here, who is Josephine, who we call Joe, I'm casting my vote for her too, because your leadership, Joe, is what's going to make her life better for years to come. Wish you the best, Joe. Have a great town meeting.
Test 1 2 test 1.
Okay, good. It's coming in. Okay, it's coming. Slide.
I'm sorry for this technical difficulty for all those folks on the line. Such incredible senators like a friend of mine, Tammy Duckworth and Dick. Joining us today, and I want to thank everyone for tuning in. Look, technical difficulty. Say, I know that thoughts now. As well as our putting ourselves in the line to try to help people. Yesterday, I had an opportunity to address and outline my plan for overcoming this crisis. A comprehensive public health response to COVID, testing, treatment for those who need it, laid out an economic response to families, small businesses impacted by this crisis, immediate relief. That's the can't wait until inauguration day next year. Action now. Ready to take additional action as health and economic aspects of this crisis develop and they get worse. Look, we need to lead with science. That's a start. We need to listen to the public health professionals. Transparency. We need to restore public trust and confidence in the U.S. government. The U.S. Pelosi has stepped up. She just recently assembled a package to deliver vital immediate relief for the American people. This evening, the Speaker announced she's reached a deal testing available free, provide paid leave for everybody, food assistance for vulnerable Americans. Americans should be grateful for the Speaker's leadership and for Majority Leader Schumer's leadership and the Senate side in this critical moment. Look, these are important steps, first steps. We have much, much more to do and a long road ahead. But I know that the American people are up to this challenge as they always come to any challenge. We will summon the spirit of empathy, decency, and unity in this country to overcome this moment. It's going to require us all to be prudent and proactive. This is the responsibility of each of us to protect our families, our coworkers, and our neighbors, and especially those who are most vulnerable to serious health outcomes. No exceptions. That's why we're connecting virtually today. We're going to have to get better at the technical side of this. No president can promise to prevent future outbreaks. But I can promise you that when I'm president, we will prepare better, respond better, recover better. Science. I'll listen to the experts and heed their advice. Rebuild American leadership and rally the world as we did in our administration. Always, 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 always truth from me, our administration. This is the responsibility of any president, and I promise you, I will meet that responsibility. The American people are owed. We owe that to you all. Now, days ahead, but still lie ahead. I know this country will summon the spirit of empathy, decency, and unity. We've never failed in a moment of crisis. In times of crisis, Americans stand as one. Volunteers raise their hands to help. Neighbors look out for neighbors. Businesses take care of their workers. So we'll meet this challenge and we'll do it together. As I said, it's critical that we allow the public health officials to lead through this moment. I want to make sure that's exactly what we're doing. And that's why I'm going to turn things over to Dr. Murtha. He was a Surgeon General. He's one of a number of experts on my team, and I want to thank you. And Doctor, maybe you can if we can transfer to you, say a few words.
Thank you so much, Mr. Vice President. I want to thank you for making the coronavirus an important focus for today. There's a great concern all across our country. We've seen dramatic spread of this virus around the world, but we've also seen a rapid growth in cases here in the United States. We now have over 2,000 cases and more than 40 deaths all across our country. But we're also quite limited in our testing, so we suspect that that number is quite higher. And in the coming days, we expect to see more and more cases discovered in more communities across America. That's the bad news, but there is good news as well, because as dangerous as this virus is, despite the fact that it seems to be 10 times more lethal than the flu and spreads just as easily, cases and more than 40 deaths, we do know that there are measures we can take to protect ourselves and others. And I want to take a moment just to recap what those are. In terms of our personal hygiene, washing our hands, as simple as it is extraordinarily powerful in preventing us from getting sick, but also in preventing us from taking this virus on our hands and on our person to other people who might be more vulnerable. Using hand sanitizer whenever you can, when you're not able to wash your hands, is important. Not touching your face, especially when you're outside. And cleaning surfaces, especially your keys and your phones, are very important because we know the virus can live on surfaces like metal and other surfaces for many hours at a time. But we also know that as we're waiting to discover just how many cases are in the US, that we can't just sit back and focus just on our own hygiene. We've got to think more broadly about what measures we can take in our communities in order to decrease spread. And that's why you're seeing a lot more talk about mitigation, which a big part of which is social distancing. I like to think of this more as physical distancing, because I think we still got to find ways to maintain our social ties with each other. That's really important. But that distancing means that we should telework whenever possible instead of going into work. It means that we should rethink how we greet people instead of going for a traditional handshake, that simply a hand on the heart or other non-contact greeting is important. And as much as we all love going to concerts and to large sporting events, those kind of events can be places where this virus can spread. And so we have to pull back on those, as painful as that may be, in order to protect our larger communities. I do want to say, though, that finally, the piece of this that it's important to emphasize is that we cannot get through the coronavirus pandemic alone. We can't do that as individuals. We can't do that solely as the United States. We're going to have to depend on each other. We're going to have to look out for each other, including the elderly, the vulnerable, people who may run out of food or who may have difficulties getting help when they need it, but who may depend on us to check in on them and make sure they're okay. And as a country, obviously, we know that what happens in one country halfway around the world in terms of an outbreak can affect us in a moment's notice. And we have to work in partnership with other countries to make sure that we're safe. I want to thank all of you for participating here. And as you think about going out to vote, I want to just remind you, if you're going to a polling station, to get in and out quickly. Make sure you wash your hands when you come back. And make sure that, certainly if you're sick, that you don't go out, because you could expose other people. And if you're in a higher risk category, if you are above the age of 60, and if you have illnesses like diabetes or heart disease, and are in general in frail health, I would recommend that you call your county election commission to make sure you can take advantage of any emergency measures they have in place to allow you to vote via mail. So thank you all so much for your attention to this topic, for helping protect our communities. And I'm going to turn it back over to Gabrielle for the Q&A.
Take it.
Thank you, everyone. If you have questions, please raise your hand utilizing the raise hand feature online. If you're called in, hit *9 to be able to raise your hand via the phone. We'll let questions populate for 1 minute, and then we will select participants. We're going to take our first question from Chris Broxson. Chris, you are live.
Mr. Biden's speech was garbled the entire time.
We appreciate you bearing with our technical difficulties. We're going to take the next question from Fannie Moy. Fannie seems to have dropped. We're going to take the next question from Georgia Johnson. Georgia, you are live in just 1 second.
Georgia's on mute.
Georgia, you're live.
Oh, okay. Well, one of my questions was, as far as Joe Biden is concerned, what exactly will he do to accommodate those of us who are Bernie Sanders supporters? If we're going to turn from Bernie to him, what is he going to do to satisfy us?
Am I live? Can I respond? Well, first of all, Bernie and I are friends, and a lot in common. And,
So what's happening here is it's taking the feedback from the audio and it's like looping.
Bernie and I agree on a whole range of issues. We agree on the essence of how we're going to proceed on the issue of climate change and education. And there's a disagreement on how rapidly we can move to health care. But what I'm going to do is Bernie and I are going to work together. And if he's the nominee, I commit that I will support him heavily. I'll do everything I can. And he's saying the same thing. And but we, across the board, there's a whole range of things we agree on, from dealing with student debt to making sure everyone has adequate health care, affordable health care, and that those who can't afford it get it for free. Find ourselves in a position where we really allies and let them know our word can be kept, making sure that those who are adversaries know that we're back and we're going to keep our sacred commitments to our allies. We're going to work in the direction of making sure that we make sure that everyone, in fact, has access to education. We're going to, for example, one of the things that I think Bernie and I agree on, I'm going to endorse Elizabeth Warren's bankruptcy proposal, which in fact goes further, allows for student debt for a whole range of other issues, and allows us to dealing with their circumstances. So there's a whole range of things we agree on. But I would hope that they would take a look and this be a matter of alternatives. You know, we may not agree with every detail that I propose, but the fact is that it's often difficult to conclude that we share Donald Trump. My team, and I believe the people backing me will back Bernie, and I hope they'll do the same thing.
It's right here, sir. Just gonna pick up your audio.
We are going to take a question right now from Deanna Payne. Deanna, you are unmuted.
Am I on camera?
Can you hear?
Hi, Mr. Vice President. Thank you for taking the time to do this today. My question is in regard to healthcare. I understand that you want to expand on Obamacare and add the public option. Could you go into a little bit more detail about how co-pays and prescription prices would be affected by your plan?
Yes, I can. Number one, for those who in fact cannot afford and have to take the public option, there would be no copays, number one. Number two, we in fact subsidize the Obama plan to a tune of $750 billion over the next 10 years to provide for, there'll be no surprise billing, no situation where drug prices can go up beyond the cost of inflation. I set up at the Department of Health and at NIH a group of experts that are going to determine whether the bio-based drugs, as opposed to chemical-based drugs that are coming on market now, and only one or two companies are working with them, have them set the price, the initial price of that drug. Again, it cannot be raised beyond the cost of inflation, medical inflation. And in addition to that, I make sure that Medicare can negotiate all drug payments, that in fact how much they're going to pay, and driving down the cost of drugs. And there's many more aspects of that, but the way I do it is providing the public option and further subsidizing access to the goal plans that exist within the. But what it doesn't do, it doesn't require you, if you have insurance, like over 100 million people do, who they've negotiated with their employer that they like very much, they don't have to give it up. They can make that choice. But if the employer cuts the plan, they can buy into the Medicare, and if they can't afford it, they can get the Medicare option that is in my plan.
We are going to take another question from Dan Joyce. Dan, one moment, you'll be unmuted. Dan, you're unmuted.
Mr. Vice President, thank you for taking the time to do this.
It's so difficult, Dan. I apologize.
That's quite all right. This has to do with the current health crisis we're in, and how would your health plan deal with this current health crisis that we're all facing right now? What would be the advantages of your health plan versus what we have now, given I believe there are a number of people who feel very insecure about their health care right now. So I was just wondering how the plan that you proposed would be dealing with this issue right now.
Dan, it would cover all the costs that would be associated with the loss of that you would have, in fact, any doctor's bill you have, any bill, a hospital bill, it would be covered. But here's the main thing. I can get this passed. We can get this passed, and we can get it passed quickly. And even Bernie acknowledged it's going to take 4 years to pass his plan, and then it's going to take longer time beyond that to get it implemented. We need to assure people we can do this quickly. I was one that the president asked to go get the votes for Obamacare. We got the votes, and I would restore all the cuts that Trump made in Obamacare, adding the public option, providing for the additional funding that would provide for no hidden bills, et cetera. And I can get it done. I can get it done quickly, and people will be covered. But even I can't do that for another a year between now and November, or actually January. But to be covered.
We're going to take a question now from Maureen Jenkins. Maureen, you are unmuted. Maureen?
Maureen, are you there?
We're going to take one more question from Marie Perkins. Marie, we are going to make you unmuted right now.
Good evening, Mr. President, and that has such a nice ring to it.
Thank you, Marie.
My question to you is, do you support the Endangered Species Act, and will you prohibit animals from being hunted and brought into this country for trophies?
Yes and yes.
Oh, I love you.
But look, I want us to say something beyond that. One of the things that I did early on in my career as a U.S. Senator was I was one of the sponsors of the Endangered Species Act. And one of the other things we've done is we, in the state of Delaware, for example, set up the coastal zone legislation, which means that they can't build any factories or anything within 1 mile of the estuary of the Delaware River and the Atlantic Ocean and the Chesapeake. And so the whole point of this is that we can do a lot to deal with endangered species. And one of the things I would like to raise is that we have to deal with this on an international basis as well. Because right now, for example, we have a thing, Brazil has the Amazon is burning because they're trying to clear the Amazon in order to make money in agriculture. What I'd be doing is organizing the entire world to say, stop now, stop doing that. We will pay you $20 billion no longer to do this because you have an opportunity to be able to make up for the loss of being able to have this Amazon become farmland. But here's the deal. More carbon is absorbed from the air in what they call this carbon sink, the Amazon, than every bit of carbon that's emitted in the United States of America on a daily basis. So the point I want to make is this goes beyond just what we're going to do here in this nation. We've got to be able to reach out and make sure the rest of the world engages. We make up 15% of the problem. The rest of the world makes up 85% of the problem, including relating to endangered species. And so one of the things we have to do is immediately rejoin the Paris Climate Accord, which I helped put together. And then what I would do is in the first 100 days, invite the major polluters in the country and the major abusers of endangered species to the United States of America and up the ante on what we have to do. There's much we can do. Go to joebiden.com, take a look at the acts I would take immediately relative to the environment and endangered species, as well as go to joebiden.com and take a look at the number of proposals I've laid out to deal with the virus as well. I'm sorry this has been such a disjointed effort here because of the connections, but there's a lot more to say, but I've already probably said too much to you.
Thank you to everybody for joining. We appreciate this and we do apologize for the technical difficulties that we had. Remember that Election Day is March 17th. If you want to find out more information about voting, please go to joebiden.com or text join to 30330. Thank you, everyone, and have a great night.